Hello friends, myself Dr. Pranaya Bagde. I am here again with another video, an informative video for you which is based on hair related issues, that is platelet rich plasma therapy. You all know whenever you have hair fall, now the modalities of treatments are so many. It varies from medication to use on the scalp to oil to shampoos up to injections and even hair transplant surgery. So in this treatment ladder, PRP stands where? It stands in the middle of it, I would say. Because PRP is an adjuvant treatment. What is PRP? It is platelet rich plasma therapy. As you all must be knowing that in our blood we have RBCs, WBCs, as well as we have plasma. So in PRP what do? We extract your plasma from the blood. We take out almost 16 to 20 ml of blood, we centrifuge it, and then from that RBC, WBCs are separated and plasma is extracted. This plasma also has fibrin, and when the fibrin is also removed, it is serum. So we don't remove the fibrin. With fibrin we take out the plasma, which has lot of concentrated platelets and that are actually useful for your hair. So how does the PRP help? Because the platelets in this plasma, they are concentrated enough and they release lot of growth factors, because platelet derived growth factors, fibroblast derived growth factors, there are epithelial growth factors, there are a lot of growth factors which are there in our plasma. So these growth factors in concentrated form are getting available for the hair growth. That is the essence of doing PRP. Then next is, who can undergo PRP? Anybody who has hair fall can actually undergo PRP, but before PRP you have to undergo a list of investigations. What does it include? So the investigation before PRP include your complete blood count. We have to know whether you have adequate platelets, whether your bleeding time, clotting time is normal, whether your prothrombin time is normal, whether you had any infection in your blood. If any of this is normal, then you can straight away go for PRP. But if you have any blood related issues, if you have coagulopathy, if you have bleeding disorder, if your platelet count is really low, if you had any viral fever, or if you have any severe infection like hepatitis B, C, HIV, or even cancer, maybe the PRP is not a treatment for you. This was who can undergo and how you go ahead with the PRP. When I say how you have to go ahead, it is to be done in sessions. That is what I mean. So how many sessions you need? Once it is decided that PRP is to be done for you, you have to do it in session. So the interval between two PRPs is 3 to 6 weeks. So minimum of 21 days is the interval between two PRPs. And how many sessions to do? Minimum of 4. Up to 6 to 8 sessions you get the optimum result. And after that you have to maintain the treatment. So for maintenance it is advisable that you do at least 3 sessions in a year. So like that 3 to 4 sessions you can do in a year to maintain your hair growth. The cost of the treatment, that is a very important thing. So the cost of the treatment can vary from minimum of 2000 rupees up to 20,000 rupees. So what determines the cost? Definitely cost cannot determine the quality of the plasma that you get. But yes, depending upon the type of tubes that are used for blood collection, the type of machine is used for centrifugation, and the type of method that you use in centrifugation while extracting the plasma, it depends, and that is what it determines the cost. At the same time, how you are injecting the PRP. At times, we have to do derma roller while doing PRP. That is one of the effective method actually, which enhances the circulation as well as it enhances the growth of the hair and collagenization also. Along with that, you have to continue the medication. So when you combine everything together, the cost of the therapy goes high. But mind well, PRP alone may not give you good results. So PRP always has to be combined either with topical solutions or with hair transplantation surgery. Then the next question arises, if we are doing hair transplantation, what is the need of PRP? But mind well, there is a shock mechanism. Whenever you undergo hair transplant for your bald area, the existing hair has the effect of that. So out of shock mechanism, that hair may go off or your baldness may progress. So at that very time, if you are doing PRP treatment, you can prevent that hair fall and you can sustain the hair growth. So after transplant, PRP actually helps for growing the transplanted hair as well as for retaining your existing hair. In females, PRP is very helpful because the growth factor that are being provided to the scalp, they gives lot of nutrition supply, lot of blood circulation is increased on the scalp, and it gives very good results. Because you all know in females, more than hormonal is the nutritional factor that is important. So when doing PRP for females, we get good results. But if it is hormonal dependent, definitely you have to undergo the evaluation for the hormonal imbalance and has to correct it. So in a nutshell, I would say PRP is very good. It is a very safe method above all, because it is your own blood, it is not a synthetic product, and ample number of growth factors are there running in our blood, so that are actually being available for the scalp growth and for the hair growth. So it is definitely a very safe procedure. Only the problem is pain tolerance. At times people say the injections that were given, it was too horrible. But if you are using proper technique, either you can use topical anesthesia, you can even inject anesthesia on the scalp, or you can use a vibrator machine just to nullify the effect of pain. So if your pain is handled well, the PRP treatment is absolutely very fine. And post PRP, you have to take little care that you cannot scratch your scalp, you cannot oil, you cannot massage, or you even can't shampoo for 48 hours. After that, you can just do anything that you are doing on your scalp regularly. So 48 hours care is very much mandatory after transplant, because the capillaries are active, the plasma is sitting there, so it has to settle down. So at that time, if you don't irritate your scalp, it's quite good enough to get good results. And mind well, any number of sessions that are advised to you, there are individual variations. So for one individual, if 4 sessions are enough, maybe for the another individuals, 10 sessions also may be needed. So that depends on your scalp condition, that depends how well you tolerate the therapy. Thank you for watching, and we'll come again with more informative videos. Keep watching our channel. Thank you very much.